Assalamu alaikum everyone. Now we should start disorder of the WBC, in which first we will discuss acute leukemia. Before going to the discussion of the leukemia, here are some points about hematopoiesis. In hematopoiesis, stem cells are present in the marrow which convert into the lymphatic stem cells and myeloid stem cells. These lymphatic stem cells then convert into natural killer cells, B cell, T cells. These B cells further convert into plasma cells, and these conversions occurs in the blood or in the tissue. And the dendritic cells are produced by both the cell lines. Then we have myeloid stem cells. So myeloid stem cell also convert into dendritic stem cell. They also convert into mast cells, and they forms myeloblast, which forms basophils, eosinophils, and neutrophils. Then we have monoblast, which convert into monocytes and macrophages in the blood and tissue. Then we have megakaryoblast, which convert into megakaryocytes and thrombocytes. And then we have erythroblast, which convert into reticulocytes, which further converts into mature erythrocytes. So these all are the steps of the leukopoiesis, while these are the steps of thrombopoiesis, and this is erythropoiesis where RBC forms. Here are some hematology. So the gene mutation occur in the cell lines, which occur either in the marrow or in the lymph tissues. If it occurs in the marrow, so it leads to leukemias, myeloproliferative neoplasms, and myelodysplastic syndrome. While if it occurs in the tissue, it leads to lymphomas. So we have lymphoma, chronic lymphocytic leukemia, and acute lymphocytic leukemia. These are the derivatives of lymphatic cell line. While acute myeloid leukemia, we have myeloproliferative neoplasm, chronic lymphocytic leukemia, and myelodysplastic syndrome. These all are the types of myeloid cell lines. Now some points about lymphoma. So it occurs in the lymphatic system from mature lymphocytes, and the symptoms depend on the type, but we have usually B symptoms, which are fever, night sweat, weight loss, and we have a large lymph node. Then we have acute leukemia, in which we have acute lymphoblastic leukemia and acute myeloid leukemia. They occur in the marrow and occur from the precursor cell, not from the mature cell. So the precursor cell cannot convert into the mature form. What will be the clinical findings? We will have erythropoiesis, thrombopoiesis, and leukopoiesis. Then the lymphoma can also in the cells in the lymph tissue can also comes to the blood, leads to leukemic lymphoma. Then they can also infiltrate the marrow, so lymphoma with infiltration, and then they can present with the swelling, so leukemia with lymph node swelling. And then leukemia with lymph node swelling can also occur. Now in these neoplasm we have increased quantity and the quality is limited. They are non-functional immature cells. Then we have myeloproliferative, so overproduction occur in the marrow, quantity increase and quality is initially not limited. Quality is initially normal and quantity is also increased. So in the erythrocytes increase leads to plethora, platelets increase lead to thrombosis, and granulocyte increase leads to cellular thrombi formation. Myelodysplastic syndrome, so this is the marrow dysfunction, increase quantity, decrease quantity in blood. So increase quantity in the marrow and decrease quantity in the blood, and the quality is limited because these are the dysplastic cells. Symptoms depend on the reduction. Commonly erythrocytes are reduced leads to anemia. We also have bi or pancytopenia possible, leading to bleeding infection.